Let's meet glya through John. The health system in his country has some issues. John has access to some services, but he doesn't feel comfortable with them. Some are assigned after a long time, in remote places, and in most of the occasions without the quality he is expecting. After 2 weeks, he gets the same prescription, as always. Also, his medical history is in many places. None of them is complete, and he has little access to it. John is in a bad mood, and his health isn't complete. He wants opportunity, accessibility, and quality in his service. Let's also meet Dr. Watts. This specialist doctor works in multiple places alternately, spends lots of time traveling between them, and also his patients' clinical information is scattered in various institutions. Mr. Jefferson is a partner in a clinic, with patients attending with problems for which the institution hasn't the indicated specialist. These patients have to go to other clinics or even to another city, losing incomes and increasing the number of disappointed patients. glya was born for this. glya is a set of online services that allows from a website, a mobile device, or even supported by a phone call to do online medical consultations, control the health of patients, refer cases to other professionals, and even create communities of people with specific diseases. On the platform, health professionals, providers, and patients share multimedia clinical information. Mr. Jefferson is happy. Now, his clinic consults professionals in other cities and even in other countries, providing services he didn't offer before, and his patients don't have to leave the city. But Mr. Jefferson has reasons to be even happier. His institution is in the glya network, allowing it to be contacted by patients and institutions from the same or other cities, get feedback and recommendations, and control his patients' health from distance. Dr. Smith now controls his patients' clinical history from different institutions because glya can communicate with the information system of the places where he works at. Also, at night, from home, he answers his patients' interconsultations where they can ask for a concept through the platform. Dr. Smith doesn't have to travel so much anymore. He's closer to his patients and his efficiency has increased. And what about John? He is the happiest person of them all. Through glya, he can check the doctors' and institutions' profiles online, recommend and rate them. Besides, his clinic history is always available to be shared with the professional he chooses, or he can just hide it from the ones he dislikes. Now John goes to the doctor only when necessary. He gets recommendations from his physician at home. His mobile device alerts him about appointments and drugs. And the best of all, he is more connected with his health system, reducing the risk of new medical admissions. glya connects health professionals, providers, and patients in an open, collaborative, and global network. glya is all your health online.